CJ McCollum is out indefinitely after a CT scan revealed a pneumothorax, and in this video, I'm going to teach you exactly what that means. Welcome back, everybody. I'm Dr. Brian Sutterer, and in this video, we're going to be walking through what in the world is a pneumothorax. Going straight to our anatomy here, a pneumothorax is often described as a collapsed lung, specifically pneumo meaning air, and thorax basically being the chest. So this is abnormal air inside the chest. In the case of a pneumothorax, specifically within what we call the pleural cavity, or the cavity where the lung sits. Under normal physiology, our lungs expand and relax with sort of the expansion and relaxation of our chest. There's a layer of tissue called the visceral pleura that directly covers the tissue of the lung, and then on the inside of the chest cavity is a layer of tissue called the parietal pleura. There shouldn't be any air between this space and what we call the parietal space. But for a variety of reasons, sometimes spontaneous or sometimes induced by something like a rib injury, air can basically get into that parietal space, which causes the pressure to increase. And as the pressure increases in that parietal space, it basically squishes the lung down. So we talk about it as a collapsed lung, but it's not like the lung just pops and deflates. There's an abnormal amount of air within this parietal space, and that increase in pressure because of the air in that space forces the lung to basically look like it's collapsed. In CJ's case, it sounded like he initially had what was described as a rib contusion, but then a CT scan of his chest ultimately showed that pneumothorax. Now, I will say the fact that they had to do a CT scan to find it is probably a good sign, because generally if these are severe enough, you're going to see it on a standard chest x-ray. There's two general types of pneumothoraxes, either a simple or a tension. A simple pneumothorax means that there's some air accumulated in this space, but it's not continuing to build up and accumulate. A tension pneumothorax is when enough air builds up in this pleural space that you essentially have a one-way valve. The air can't go anywhere out. And so as you take in more breaths, more and more air builds up until eventually it compresses on the nearby structure, specifically the heart. A true tension pneumothorax is legitimately a life-threatening situation where you need to get this emergently looked at and treated to relieve that pressure from inside the chest. But just a routine simple pneumothorax, we describe based on the percentage of the lung that's collapsed. So here in this model, of course, the left lung fully expanded, the right lung has been collapsed, and based on this amount of apical air, we'd say, I don't know, maybe 25, 30%. If it's a really small amount, then oftentimes doctors don't have to do anything. But if it's significant enough, we'll actually put a tube in through the skin, in between the ribs, into this space to allow that pressure to get that air out of the chest wall. I've personally had two of these. In my case, they were spontaneous. There was no trauma related to it. And I can tell you, it's extremely painful. Having that chest tube put in is also extremely painful. And so hopefully McCollum isn't having to go down that route. Recovery time is highly variable depending on the severity and if they have to do something like put in a chest tube. Jeff Stott's, a great resource for this type of information, mentioned that the average time missed is around 6.5 games. So oftentimes these are small enough where they don't have to put a chest tube in. Basically, the body just resorbs that abnormal air. Wherever that defect was that was allowing air into the chest basically scars over, heals up, and then shouldn't cause any long-term issues. So hopefully this is a short-term absence for McCollum. Again, these pneumothoraxes can certainly be life-threatening depending on how large they are, and if it's what we call a tension pneumothorax, where you get increasing and increasing pressure, which can ultimately push on the heart, impacting the heart's function. That's it for the video, everybody. Let me know, as always, any questions or comments down below, and until next time, we'll see you later. Bye.